In medieval Europe, more than 1 in 3 people would die from simple infections that today we treat with a single pill. But here's the question that should stop you. How did a world without hospitals, without antibiotics, without anesthesia, actually keep people alive? And what did illness feel like in an age when pain was a punishment, disease was a mystery, and survival was a gamble? Every faded parchment, every monastery record, every surviving medical manual reveals a truth we often overlook. Medieval Europe didn't simply suffer from illness. It battled it, creatively, fearfully, sometimes brilliantly, sometimes disastrously. But always humanly. More than half of all medieval deaths were linked to infections. A broken leg could end a life. A cough could doom a household. A fever could sweep through a village like wildfire. Yet despite these hardships, medieval physicians developed systems of care, healing rituals, surprisingly advanced surgeries, and entire networks of medical knowledge that stretched across continents. But the real story begins not in a castle, but in a dimly lit cottage on the edge of a forest, where a mother hears her son coughing through the night and wonders if he'll live to see morning. For the next few minutes, let's step into this world. A world where illness was a puzzle, injury was a threat, and healing was a mix of faith, fear, skill, and survival. People believed nearly 80% of illnesses came from imbalances inside the body, not from outside sources. Bad air could make you sick. Touch from the wrong person could curse your blood. A chill in the night could call death into your bones. But knowledge didn't stop there. Medieval Europe had apothecaries, surgeons, medical universities, battlefield medics, herbal manuscripts, and healing traditions stretching back centuries. It's time to see how people truly lived and how they truly survived. The story begins on a cold November morning in 1312. A boy named Elias wakes with a fever so fierce his breath fogs the air. His mother, Agnes, places her hand on his forehead, burning hot. Outside, frost clings to their thatched roof. Inside, Agnes knows she must act fast. Illness spreads quickly in their village, and families have lost children every winter. She wraps Elias in blankets and runs across the village to the home of a local healer, a woman named Matilda. In medieval Europe, before universities and licensed physicians reached every region, women like Matilda held communities together. They knew herbs, poultices, fevers, fractures, childbirth, and the quiet signs of death. Matilda listens to Agnes describe the symptoms: sweating, trembling, a tremor in the hands, refusal to eat. She doesn't call it infection. She calls it an imbalance, too much heat in the blood. She gathers elderflower, crushed mint, thyme soaked in warm water, and a bitter root preserved in vinegar. These herbs were some of the oldest remedies known in Europe, passed down by monks, travelers, and the memories of women who healed before her. She arrives at the cottage and examines Elias. In medieval times, physicians didn't measure temperature with tools, they measured it with experience. The flush in the cheeks, the dryness of the eyes, the heaviness of the breath. She presses 2 fingers to Elias's wrist and counts silently. Then she makes a difficult decision. He needs bleeding. It was a common practice, grounded in the ancient Greek belief that the body contained 4 humors: blood, phlegm, black bile, and yellow bile. Illness meant imbalance. Bleeding was meant to restore harmony. Matilda heats an iron blade, sterilizing it by accident, though she wouldn't know it. Medieval medicine could be strangely effective without knowing why. She makes a small cut on Elias's arm. A few drops fall into the wooden bowl. Elias drifts into a shallow sleep. Agnes watches, terrified but trusting. This is how illness was treated, not with knowledge of bacteria or viruses, but with a worldview built on patterns, signs, instincts, and inherited wisdom. But Matilda is not the only healer in medieval Europe. In cities like Paris, Bologna, and Montpellier, students crowd into dim lecture halls, studying ancient medical texts translated from Arabic and Latin. They read the works of physicians like Avicenna, Galen, and Hippocrates. They dissect animals, sometimes criminals, learning the architecture of the human body. These students will become physicians, trained not only in herbal remedies but in diagnosis, theory, dietetics, and even early surgery. They form part of a three-tier medical system. Physicians diagnose and prescribe. They have education, status, and books. Surgeons cut, stitch, set bones, and treat wounds from farms and battlefields. Many are trained as apprentices. Barber-surgeons do bloodletting, tooth extraction, simple bone setting, and wound care. Each of them sees illness differently. Let's follow another healer, Master Roland, a respected surgeon in a bustling medieval town. He works not in silence, but in noise, the shouting of apprentices, the crack of bone being set, the smell of boiling water and wine. A man brought in from the fields lies on a wooden table. His leg is fractured, twisted unnaturally. Roland palpates the bone, feeling the break. There is no anesthesia, no numbing injection, only a leather strap for the patient to bite. Roland counts softly. Then he pulls. The bone snaps back into place with a sickening pop. The man screams into the leather. His body shakes. Sweat pours from his brow. Roland wraps the leg in linen soaked with egg whites, a surprisingly effective early form of plaster, and binds it tight with wooden splints. This man will live. His leg might heal crooked, but he will walk again. Medieval surgery was not always the disaster we imagine. Battlefield surgeons could amputate limbs in minutes. They used cauterization, hot irons, to stop bleeding. They cleaned wounds with wine or vinegar, not knowing these liquids killed some bacteria. And they often learned by doing, not by reading. But medieval Europe also had hospitals, though nothing like our modern medical centers. Imagine a hushed hall inside a monastery, filled with rows of wooden beds. The scent of herbs hangs in the air. Monks move between the sick, offering both simple medicines and prayers. Hospitals were often attached to religious orders. They provided shelter, food, warmth, and spiritual comfort. Some treated the sick, others housed the poor, the elderly, the traveler. In one of these hospitals lies a merchant named Conrad. After a fall from his cart, his ribs ache with every breath. A monk places a compress of warm chamomile against his chest. He notes Conrad's symptoms in a leather-bound ledger. These ledgers, kept over centuries, became Europe's earliest medical archives. Conrad's treatment will be slow, careful, gentle. He'll receive broth, rest, and herbs meant to reduce pain and inflammation. And he might survive, if infection doesn't set in. But the most feared illnesses in medieval Europe weren't fevers or fractures. They were epidemics. Measles, smallpox, leprosy, influenza, dysentery, plague. When illness swept through towns, people looked for patterns, anything to understand the mystery. They blamed the air, the water, the planets, the moral decay of society. But they also created systems to protect themselves. They used quarantine, long before the word existed in common speech. They isolated the sick. They burned clothes, fumigated rooms, and washed with vinegar. Towns passed laws restricting travel. Ports closed their gates. Cities hired physicians specifically trained to handle outbreaks. One of those physicians, a plague doctor named Henri, walks through the streets of Marseille in 1348. His long-beaked mask is filled with herbs meant to purify the air. His leather coat protects him from bodily fluids. In his gloved hand he carries a wooden cane, not for support, but to examine patients without touching them. Henri knows his odds. Many plague doctors never live to see old age. But he continues, guided by duty and grim determination. Today, we see his outfit in museums. Back then, it was a desperate attempt at survival. But injuries were just as deadly. A farmer cutting wheat could slice his hand. Without proper cleaning, infection might set in within days. Soldiers wounded in battle often died not from the sword, but from the aftermath. Infection, gangrene, fever, rot. One such soldier, named Thomas, lies in a makeshift battlefield tent during a winter campaign. An arrow pierced his shoulder. A surgeon examines the wound. If the arrowhead is barbed, pulling it out would tear muscle and flesh. So the surgeon uses a hollow tube heated in fire to widen the wound and remove the arrow safely. Pain is unbearable. Thomas screams until his voice gives out. Then the surgeon pours wine into the wound. It burns. It sterilizes. And Thomas survives, barely, but alive. Amid all this suffering, medieval Europe also had healing sanctuaries. Sacred springs. Shrines of saints. Pilgrimage routes believed to cure blindness, lameness, fevers, even madness. Some cures were based on belief, but others, such as mineral-rich waters or herbal poultices, had real therapeutic effects. Back in Agnes's cottage, Elias slowly wakes. His fever has broken. His skin is cool. His breathing is deep and even. Matilda watches him carefully. She knows the illness could return, but for now, he is safe. Agnes thanks her with tears in her eyes. Matilda smiles. For hundreds of years, healers like her formed the backbone of rural medical care. They treated colds, fractures, childbirth complications, infections, grief, fear, and wounds. They were midwives, herbalists, counselors, and caretakers. As centuries passed, medieval Europe's medical landscape evolved. Translations of Arabic medical texts brought new knowledge. Universities formalized training. Surgical manuals spread through Europe, some with detailed illustrations of procedures we still recognize today. In the 13th century, a surgeon named Guy de Chauliac wrote one of the most influential surgical texts in history, describing wound care, fracture treatment, and infection management. His advice: cleaning wounds, avoiding excessive bleeding, ensuring proper bandaging, saved countless lives. But the real question is this: did medieval medicine work? Surprisingly, sometimes. Herbal remedies like thyme, garlic, sage, and honey had antibacterial properties. Wine and vinegar cleaned wounds. Bone-setting techniques were effective. Suturing saved lives. Hospitals provided warmth, rest, and nutrition, still fundamental to healing. And even when the science was flawed, the care was real. Communities supported each other. Monasteries preserved knowledge. Surgeons improved their craft. Physicians adapted theories. Healers risked their own lives to protect others. This is the hidden truth of medieval Europe. It wasn't a world of ignorance. It was a world of survival. A world where every cure, every treatment, every ritual, effective or not, was an attempt to push back against the fragility of life. And now we must ask, what can we learn from them? We learn that medicine grows from trial and error. That communities survive through compassion. That even without understanding germs, medieval healers managed to create systems of care that worked more often than we imagine. We learn that pain and illness have always been part of the human story, and so has the determination to heal. And finally, we learn that even in the darkest centuries, people fought to save one another. They stitched wounds by candlelight. They boiled herbs through the night. They prayed over the dying and comforted the living. Their world was fragile, but their courage was not. If you want more stories from the forgotten corners of history, stories that reveal how people lived, suffered, healed, and survived, don't forget to subscribe. There are countless untold moments waiting to be uncovered, and together, we'll bring them back to life.